Between tooth and its socket, which type of joint do you have? You are having what is called as gomphosis. Between the tooth and its socket is what you need to remember. If you look at the previous APPG question bank, every time they ask one question, which is a ball and socket, which is a hinge joint. Joint types is a very high yielding topic in the All India PG question bank, which you should basically appreciate. Can the online students can punch whether the voice is loud and clear? Resorption of the bone. Cheapest question in the planet. Ask your class. HCG is produced by syncytial trophoblasts. What is the nerve supply of teres minor? So you all know the 6 group of muscles. Supraspinatus, infraspinatus, teres minor, etc., etc. So it is the axillary nerve, which is the one which ultimately goes and supplies. The teres minor is what you need to remember. Medial longitudinal arch of the foot, what are the supports, is a very important question. We have what is called the plantar calcaneonavicular ligament, which is considered to be one of the important ligamental structure along the medial longitudinal curvature of the foot is what you need to remember. Once more, if you have done this question wrong, ankle anatomy is a high yield topic, right? So you need to have a review. In the right atrioventricular groove, between the atrium and ventricle, the groove is called coronary sulcus. So what is the vessel that passes through the coronary sulcus? It is the small cardiac vein that passes through the atrioventricular groove. Once more, coronary circulation and the venous drainage of the heart is a very high yielding topic. No way that we can say that we didn't know that. Kupffer cells are there in the liver. Testis lymphatic drainage is to the para-aortic group of lymph nodes. What is the lymphatic drainage of the scrotum? Typically it will drain into inguinal group of lymph nodes. That's the reason if you are suspecting any testicular cancer, ideally you must approach from the not transcrotally, so that you will break the anatomical barriers that are protecting against the dissemination of the cancer is what you need to remember. Once more, recent Comed K and also this exam, what is common thing? Glomerulosa is aldosterone, right? And you are having fasciculata and reticulosa. So you must know what are the other thing, reticularis, what are they doing? Then anterior belly of the digastric versus posterior belly, they have got a different nerve supply. So it is a first arch derivative which is supplied by the trigeminal, second arch is by facial, third is glossopharyngeal, fourth is vagal, sixth is recurrent laryngeal nerve. The pharyngeal arches and their muscles and the nerve supply. Oh, this question if you have done wrong, you can forget about this APPG. Don't be, let me not be too sarcastic on that ground, but competition is ruthless and fear is irrational. Knowledge should bring courage, not fear. So still another 28 days time is there. You can nicely scale up yourself. So be sure. Skin on the lower one third of the auricle. Many times we have discussed this in our mock test. Nerve supply of the auricle is a very high priority. All this area of the lobule is by great auricular nerve. Then typically you have the lesser occipital nerve along the lower helix. Then you have the auricular branch of the vagus. Then auriculotemporal. So this is how a typical depiction will be. If it is an image based exam, they will give you one of the areas and ask which nerve basically supplies. So be sure on the nerve supply of the ear is going to be once more a repeat in Kerala PG, TNPG, APPG. Next 4 Sundays we are having all these 4 exams. Kerala PG is there, we will get the paper. TNPG paper we will get, and Jammu Kashmir PG paper we will get, state PG. So I don't want to create new questions and trouble you. I want to give what exactly examiner will give you and take it as a actual exam and take the challenge. Let's see how much you are scoring. The nerve carrying taste sensation fundamentally is what? Glossopharyngeal nerve. What are the layers of the scalp? You are having the skin, etc., etc. So it is the loose areolar tissue which is basically called the dangerous area of the scalp, and bleeding there is uncontrollable. Then which nucleus you have underneath the facial colliculus in the pons? We have abducens. 5th, 6th, 7th, these 3 cranial nerve nuclei are there in the pons. 3rd, 4th is in the midbrain. 8th, 9th, 10th, everything is in medulla, as all of you know very well. Amacroin cells are in retina. But once more, what is there in the question bank of examiner high yield area? What are the different layers of retina? 1, 2 functions, and what neurotransmitter, which are glycine producing, glutamate producing among these various cells? Cerebellar histology, retinal histology. They are the 2 high yield areas for the examiner, be very sure of. So you are having horizontal cells, bipolar cells, hemacrine cells, etc., and they have got the various functions. So you must also be sure on the functions. Peripheral proteins are attached to the integral proteins and they function almost entirely as enzymes. Typically you are having peripheral proteins and integral proteins among the cell membrane. So the cell membrane structure is a very common topic to ask. So what is Poiseuille's law? So the volume flow rate is directly proportional to the pressure difference and 4th power of radius, inversely to the viscosity and the length of the tube, and resistance to flow is inversely proportional to the 4th power of the radius, is basically called the Poiseuille's law, is what need to be remembered. Now if you take the kidney, it has got the greatest amount of blood flow for every 100 gram of tissue per minute, and that is how kidney acts like a wonderful filter, is what need to be remembered. Can online students can punch? Whether the voice is loud and clear? Very happy to see 46 plus viewers. AV nodal delay. Which part of ECG reflects AV nodal delay? PR segment. So typically PR segment is around 0.12 to 0.2 seconds. Can you close this door? 0.12 to 0.20. When do you call PR delay or AV nodal first degree block? The moment the PR is prolonged beyond 0.2 seconds, you basically call it as first degree heart block. Abnormal color vision. What is the way by which it is being transmitted? X-linked recessive. No big deal. Iodide uptake is decided by what? It is decided by the Pendrin gene. Pendret syndrome, you all know, which is related to the goiter. So Pendrin is basically associated. Vitamin K is 2, 7, 9, 10. Then during normal quiet breathing, when do you have maximum amount of work done? So for the compliance of the lung and the elastic work are the ones which contribute to the maximum amount of work. One question on nerve fiber classification. We had been waiting for this question to come from ages together. So Dr. B fibers. So don't forget, 1A you have in muscle spindle annulospiral endings, and 1B is Golgi tendon organ, 2 is muscle spindling, touch and pressure, 3 is pain and cold receptors, and 4 is pain temperature. Now if you look at the susceptibility, most susceptible, hypoxia is B, pressure is A, local anesthetics is C. Then similarly for the hypoxia, least susceptible is C, pressure also is C, and local anesthetics least susceptible is A. Because how much they are myelinated, how many sodium channels are there on it, what is the diameter of the fiber, they are all the other important determining factors for this. But this table is pakka. Aap likh ke jana. Definitely one question will come on the nerve fiber classification. Once more, you will see it in Tamil Nadu PG, Kerala PG and JK PG. I will show you. Now muscle weakness in myasthenia gravis, how can you treat it? So basically if you give cholinesterase, it will improve, it won't worsen. So typically administration of cholinesterase inhibitor that will increase the acetylcholine. It will improve. Seminiferous tubules require androgen and there are FSH receptors. Once more, reproductive physiology. FSH, LH, when will they rise, and what is inhibin, what is the feedback inhibition, entire ovulation, menstrual cycle physiology. You have to be very sure. Then what inhibits the gastric secretion? Obviously when the food enters into the gut, the small intestine, secretin is produced. The moment it is produced, you don't need gastric secretions in the stomach. So obviously secretin should go back and tell stomach that please stop producing gastrin. Simple mechanism. Prosopagnosia is what? It is an inability to recognize the faces. Anjan Marna is prosopagnosia. Right? So which lobe of the brain is involved? Angular gyrus is the one which is involved, associated with it. Once more, what is the high yield topic? Lobar functions in physiology. Frontal lobe, parietal lobe, what is Blalin syndrome, what is Gerstmann syndrome, which is dominant, which is non-dominant, everything you must master. One question on lobar functions. The center of circadian rhythms is suprachiasmatic nucleus. So once more they will ask in APPG, what is antral hypothalamic nucleus doing, dorsal hypothalamic nucleus doing, which is for eating, which is for gaining weight, all those hypothalamic nuclei. Today only after going home you should. Dehydration increases the plasma concentration of everything, but not atrial natriuretic peptide. Can you give me the board please? Atrial natriuretic peptide. You know SADH? Syndrome of inappropriate ADH secretion. Whenever ADH is inappropriately produced, what will happen in the renal tubules? Antidiuretic hormone. So the water become retained in the body if ADH is excessively produced. All that water retention will lead to plasma volume expansion, and that will lead to stretching of the atria, and stretched out atria will produce atrial natriuretic peptide that will come back to the kidney, and what will it do to the kidney? It will make the natriuresis to happen. So that is the reason, what is the biochemical definition of SADH? Urinary sodium more than 20 milliequivalents is the definition. Presence of hyponatremia is a feature of SADH. And whenever the water is retained, plasma osmolarity will come down and urine osmolarity become increased. So this combination. So the stimulus for the production of the ANP is what? Plasma volume expansion, not hypovolemia. So that is what you need to appreciate. Once more, SADH is a favorite topic of the examiner. The glycosaminoglycan for the transparency of the cornea, keratin sulfate. PUFA is maximum in sunflower oil, even Granima also knows this fact. Then earliest marker of MI is what? CKMB. To know the reinfarction status, what is the best marker? CKMB. What is the specific marker? Troponin. Early marker? Troponin. So these are all the one MI. General medicine, what is the high yield topic? Highest yield topic? Myocardial infarction. Without that, there is no paper. Branched chain keto aciduria is a feature of maple syrup urine disease. Leucine, isoleucine, valine. Whenever they undergo degradation, if that enzymatic defect is there, branched chain keto acid dehydrogenase, that lead to development of maple syrup urine disease, is what need to be remembered. Then doctor, to degrade glycogen, last time what did we say in Comet K paper discussion? regulation of glycogen breakdown. Without that there is no paper, right? Last time also they asked a question. So glycolysis, glycogen, cholesterol, fatty acid biosynthesis and degradation, urea cycle, purine and pyrimidine metabolism. Where are the rate limiting enzymes? How many ATPs are produced? Everything. 2-3 hours biochemistry के ऊपर ध्यान दे सकते हैं आप. So it is the phosphorylase, glycogen phosphorylase which lead to development of degradation. Why liver can contribute to the blood glucose, muscle cannot contribute? So both liver and muscle are both having glycogen. Because the glycogen phosphorylase is an enzyme which is present only in liver but not in muscle. That's the reason muscle cannot be contributor for the plasma glucose, is what you have to basically understand. Glutamic acid decarboxylation, it leads to development of the GABA formation. गौचर इज बीटा ग्लूकोसिडेज. तो ये एकदम वो आपके जेब में से वो चिट्ठी निकालना, वो टेबल का चिट्ठी, व्हाट इज टेसैक, व्हाट इज क्रैबी, व्हाट इज फैब्री, ऑल दीज एंजाइम्स डॉक्टर मगब करके कौसल्या सुप्रजा रामा पूर्वा संध्या प्रवर्तते. मॉर्निंग ओनली यू हैव टू वेक अप एंड बी रेडी विथ ए सेट ऑफ अनफॉरगेटेबल lists that you need to have when you go to exam. Nitric oxide is arginine degradation will lead to formation of nitric oxide. Electron transport chain हमको छोड़ेगा नहीं. कॉमेड के में भी एक इलेक्ट्रॉन ट्रांसपोर्ट चेन वाला क्वेश्चन आ गया ना, तो कम से कम आप पक्का पढ़ना. That means all examiners they will all meet that, they will all meet. तमिलनाडु पीजी एंट्रेंस कन्वीनर के बेटी के शादी पे केरला पीजी एंट्रेंस कन्वीनर आएगा ना. आए तो आजकल आप क्या क्या टॉपिक्स कर रहे हैं बोल के सब लोग एक ही टॉपिक लिस्ट निकाल के टिक मार्क करेगा. तो इलेक्ट्रॉन ट्रांसपोर्ट चेन और एक बार एबीपीजी में आ गए फिर भी आप आंसर नहीं किए, मेरा जिम्मेदारी नहीं है. सो बी वेरी श्योर. सो डॉक्टर डाई यू आर हैविंग dimercaprol which acts at the level of the complex 3. If you take enobarbital, rotenone, they are at the complex 1. Malonate, carboxyl, complex 2. Antimycin A, hypoglycemic agents, val, dimercaprol, they are all at level 3. And cyanide, carbon monoxide, hydrogen sulfide, azide, they are all at 4. So please try to master this. For taste sensation you require the zinc, that's the reason you get dysgeusia if the zinc deficiency is there. Then the vitamin for intrinsic factor is cobalamin. Respiratory acidosis occur whenever severe asthma is there and you are unable to ventilate, then carbon dioxide will accumulate and that lead to development of respiratory acidosis. Urea is produced by arginase, ultimately will break down and release the urea, arginase. Even this question you did wrong means, suppose anybody answered urease, please tell me, I'll give free coaching until your lifetime, right, as a responsibility, corporate social responsibility to see that at least some reasonable doctors pass out. So I don't think most 100% of you would have answered it correctly. So the electrolytes like sodium and potassium, this is the ugly question, first ugly question. Who will remember what is flame photometer, spectrophotometer? Physiology के जमाने में we are in the heights of our androgens and estrogens. Who bothers about which photometer will do what? है ना? So but still doctor, examiner will ask such questions also. Flame photometer. Flame photometer is the one which is used for sodium and potassium. If you answer this wrong, don't worry. I say छोटे मोटे चीज़ा बड़े बड़े एग्जाम्स में चले जाते. No fear, no worry about it. Cockcroft-Gault formula. At least the examiner is not asking you to write formula. Do you know it is used for creatinine clearance is what the examiner is asking, right? And our examiner in APPG won't be that easy going. Okay, 140 minus age into weight by serum creatinine into 72 into 0.85 for females is what need to be remembered. So tomorrow, imagine yourself, you are a consultant nephrologist. So you have a patient who is in sepsis, who has got renal dysfunction, antibiotic need to be started, and that antibiotic is dependent on creatinine clearance. So आपके apron pocket में what is that? Cockcroft. Why people, how his wife calls him, I really wonder. Right? So she will get a little choking feeling while calling him or shouting on him. Galt formula. Then enzyme induction. When will it occur? This is also a little nonsense question. मतलब chronic poisoning and non-hemolytic jaundice में enzyme inducer is used to treat, that's fine. Cushing syndrome में how many will know? It's very difficult to know. I am also not sure. I am just reading out the key given by the examiner, but Cushing syndrome में which enzyme inducer do we use? Betrapone. That is an inhibitor. I am not sure which enzyme inducer examiner has in mind. Now, which is not a teratogenic drug. Teratogenic drug. Penicillins always are safe in pregnancy. Simple point, right? Somebody has a urinary tract infection, somebody has got a cough. Penicillins are considered to be safe unless there is a prior hypersensitivity. If you use oral contraceptive pills, that will help to protect against porosis. It won't predispose to porosis. Childhood vaccines are not given intravenously. They don't want to release dangerous doctors into community. You give BCG intravenously or a DPT intravenously. There is no such intravenous. They want to be very sure before giving you PG seat. Right? And if you also answer this wrong, no? Yeah, you will be notified in the WikiLeaks and you will forever be haunted. Don't let this doctor enter into medical college. All babies will be afraid. So, hit and run. What is meant by hit and run? Hit and run means whenever a drug attaches to a receptor, the drug is metabolized, but still the effect will persist, which is basically called hit and run kind of drugs. Right? So, phenylcyprine, omeprazole, reserpine are such hit and run drugs. It is like the old movie. The hero comes, there is a romance. After that, the heroine becomes pregnant and the hero leaves and marries whoever the girl his father suggests, and she grows up the baby. You have seen that movie, Masoom. Excellent movie. Last week I was watching. Oh, very nice movie. Masoom. So, guaifenesin is what? As general practitioners, post MBBS, we all write cough syrups, which are mucolytics, which are antitussives, which are expectorants. At least minimum we must know. One side you give expectorant, other side you give antitussive. Patient will suffer like a matchstick inside a box, right? Because expectoration is producing, mucolysis is happening, but you have given him a cough suppressant also. That common mistake is done by a lot of people. So, mucokinetics means they will enhance the secretions of the bronchi. Sodium potassium citrate, potassium iodide, guaifenesin and balsam of tolu and ammonium chloride. Mucolytics are bromohexane, ambrodil, etc. They are all mucolytics. Then doctor, Paget's disease, what will you use? We use plicamycin, calcitonin, biphosphonate to counter the hypercalcemia and osteoclastic resorption in case of Paget's disease. Mifepristone is antiprogestin. Angiotensinogen to angiotensin 1 inhibition is done by eliskerin, renin inhibitor. Then direct renin inhibitors. Then which is a uterine stimulant, doctor? Oxytocin, ergometrin, dinoprostone, but maxsulfate act like a tocolytic. Gilulutin is leukotriene synthetase inhibitor. Zofirlukast is receptor antagonist. How do you remember? Lukast, KAST. A is antagonist. Gilulutin, TO is there, no? Leukotriene. Of course, this is also leukotriene, but I used to remember gilulutin like that. So, some way to remember. Linezolid is what? Linezolid comes under the classification called oxazolidine-diones. So, you have oxazolidine-diones, glycyl, cyclin, cyclic lipopeptides. That's how the newer class of drugs have been divided into. One question on insulin, without that my soul will be restless in the graveyard. Right? Lispro insulin, Glargin insulin. रात में देते ना, एक 10 यूनिट डाल दिए तो कल रात 24 hours तक वो काम करेगा. No problem of hypoglycemic attacks. Beautiful drug is Glargin insulin. So it will come like a pen, and even grandma doesn't need grandpa to do that. So she herself can be able to punch it and then say, yeah, I am ready for eating laddu. So that is regular insulin is intravenously given insulin. Ornidazole is not proton pump inhibitor. Two fundamental questions. Which are all zoles are not ketoconazoles. At least that is important to understand. Metronidazole is different from ketoconazole, is different from ornidazole. Why do they create drugs like that and make our life miserable? So be sure the lowest concentration is basically called minimum inhibitory concentration. All of you know very well. Ketamine is contraindicated in other scenarios, but hypovolemic shock, it is indicated because it will improve the BP. Once more, ketamine, fluoxetine, lithium, amidaron, digoxin. Without that, there will be no paper. One of these five will come. So ketamine is good for hypovolemic shock. Ketamine is good for changing the dressings. Whenever you are doing changing of dressings, as an analgesic effect of it will help. So like that, there are 10 points special about ketamine. To correlate the clinical effects, you need to measure the plasma concentration. In case of gentamicin, theophylline, carbamazepine, in all these things you will do the drug values, but not for heparin. What is the speciality of ziprasidone? Ziprasidone is free from all the anticholinergic side effects which are there with the other antipsychotics, which is one of the great advantage. Also, weight gain is not a feature, which is a feature of others, olanzapine, clozapine, etc., but not ziprasidone is what you need to remember. Once more, Dr. Antipsychotics classification. SSRIs, SSNRIs among the depressants. What are typical atypical antipsychotics? All that, thoda 1-2 ghante you have to spend time, right? So we have all that stuff in the online video library at anatomy2medicine.com. Please review. Megaldrate is used as what? It is a non-synthetic antacid. Hydroxy magnesium aluminate complex, and it is being converted into magnesium hydroxide and aluminum hydroxide. They are absorbed poorly, and that is the reason they provide a sustained antacid effect. That is the story of megaldrate. Antacids is one topic we somehow think, anyway we know pan 40 milligrams. So that is all that we need to know about antacids, we think. But there is a little story, lot of questions are asked. So just review that. Losartan typically acts on angiotensin 1 receptor. This is little cruel question. Losartan 81 or 2, who want, man? How does it matter, and how can it be a stopping factor from you becoming a cardiologist? Yeah, cruel filter. But remember, Even a topper will not read that carefully whether it is 81 or 82 unless he is an obsessive snob. Right? So that's the reason. Don't regret if such questions go wrong in the exam hall. This is a atypical question on a typical topic. That's a problem. Wound contraction is myofibroblast, and RAS gene is a growth promoting gene involved in oncogenesis is what you have to basically remember, and it is involved in various tumors. Once more, top 10 high yield topics in pathology अगर आप list देखें तो oncogenes is a favorite topic in pathology, right? So that's the reason you must be sure. एक एमिलेडोसिस जरूर आएगा ना. रिसेंट कोविड के में बीटा 2 माइक्रोग्लोबुलिन इन डायलिसिस एसोसिएटेड एमिलेडोसिस पूछा, और इसमें भी एमिलेडोसिस है. ये रेगुलर होता है. वेजिटेरियन थाली साउथ इंडियन स्टाइल बोले तो पप्पू रहना, दाल तो रहेगा ना, उतना गारंटीड है एमिलेडोसिस का टॉपिक. तो बीटा प्लेटेड शीट इज एक्सरे क्रिस्टलोग्राफी. Speckled pattern of immunofluorescence typically is seen with anti-Smith. This is called speckled pattern. Recently we have given in one of our mock tests directly the immunofluorescence image and asked you where do you see this. So typically it is seen with anti-Rho and anti-La antibodies is the speckled pattern. Okay, so that is anti-Smith in this case. Okay, then BRCA1 gene, where is it located? 17th chromosome. Distinctive triad of all these interstitial 3 monkeys. Don't see, don't hear, don't talk are there, no? It is all congenital syphilis. Non-caseating granuloma means I would have jumped to sarcoidosis, but he has given acid-fast organisms means I like to consider leprosy. Kaposi sarcoma is HHV8. What was the recent question in COVID-K? HHV, what is varicella zoster virus? Which human herpes virus? 3 are the, what is that? 3, no? So HHV पूरा family पढ़ना है. They like Nizam dynasty. Nizam 3 क्या किया, Nizam 2 क्या है, असल नाम क्या है उनका, उलूम कौन है, वो सब पढ़ के जाना. तो HHV 3 कौन है, 8 कौन है. Then what is the structural abnormality of the chromosome? Where one arm is lost and the remaining arm is duplicated. What do you call it as? You call it as isochromosome. So there is a loss of P arm and there is a duplication of Q arm is what need to be remembered. Subepithelial cambium layer. This is a nonsense question. Who will remember? It is a part of rhabdomyosarcoma unless you have finished diploma pathology and trying once more for MD entrance. So it's an outlier question, not a common question. So there is something called cambium layer which is there in angiomyolipomas and rhabdomyosarcomas, etc., etc. 30-year-old asymptomatic not requiring blood transfusion, HbA2 is 2.5 but HbF is 95%. That is called as persistence of fetal hemoglobin. You answered it as thalassemia major or minor, right? No. 30-year-old lady, this over. Then hepatic vein obstruction is called Budd-Chiari. Destruction of fat in acute pancreatitis is basically caused by lipase and trypsin. That is a mechanism in pancreatitis. There is cytokeratin positivity is a feature of carcinoma. Once more, the various tumor markers is a favorite topic in pathology. Autosplenectomy, where does it occur? Sickle cell anemia. Albumiноcytological dissociation is Guillain-Barré syndrome. Munro microabscess is psoriasis. Samoma bodies are not seen in HCC. Medulloblastoma, the name itself we remember it as cerebellar medulloblastoma. So easy to remember. Himmelstein-Wilson is diabetes. अभी आ गया ट्रिकी क्वेश्चन. एक्चुअल एग्जाम, दिस इज अ टिपिकल एपीपीजी 2012-14 वो जमाने में था. Don't expect this kind of ABPG exam, right? We don't know. If examiner suddenly decided to give all easy questions, still he will create 25-30 questions. Actual exam will be only for 25-30. The 25-30 will be deciding factor, you are in or out, right? So this is a little tricky question. What is your answer? How many answered this correctly? Can raise hand. Oh my God, you are all malignant, right? Even this also you answer correctly means you are malignant, ready for attacking exam. Suicide bombers, Retina, on exam. So you belong to that category. Good about it. See, it's all that intense determination, doctor. This is intense determination that I and only me is going to get it and I am going to make it happen is what, how much you are next 1 month, how much you accumulate all your energies to be on the mission is all about it. It's only a question of that focus, sticking to that single dream. However, any number of nightmares come in the middle, one single dream that it's me who makes, all others, oh, they're all weak souls on this planet. I am the avatar. You must think and then sit for exam. Please let me tell you. Don't let any other feelings come that maybe can I read full day? Oh, is it me who is going to do that? I say, soch ke nahi jana. It's you. You already have proven that you can do that, and that's how you got it into MBBS. And you are going to just one more time replicate it. And once you get seat in PG, every day you have to replicate the same donkey ship. So don't think life is very simple and happy after getting PG. No, doctor, another game starts. Only end of this game and just start of a new game, that's all. We keep on playing new games. To marry is a game, to get children is a game, they need to study is a game, they need to marry is a game, and ultimately you will get chronic illnesses and one apototic evening you are popped off into the cycle of life. So everything is enjoy the journey. So it is the mummified Reed-Steinberg cells are associated with classical Hodgkin's, while popcorn cells are lymphohistiocytic and they are typically they are in the nodular type of Hodgkin's, and typically they are CD20 positive is what you have to basically remember. All ovarian tumor classification, doctor. Without ovarian tumor, there is no paper. Ovarian, endometrial, carcinoma cervix, 3 cancers and breast cancer. Right? So, Brenner is not, is a, so you have surface epithelial stromal tumors, sex cord stromal tumors, then you have germ cell tumors, and you have endometrioid, clear cell, transitional, squamous, etc. blah blah blah. Among the serous tumors, you have malignant, borderline, and benign. So this list is there, no? Shaw may. You must read. Highest risk of malignant transformation is there for villous adenoma is what you need to basically remember. Huh? Option? Oh no. You are biased by another question. That question is, Peutz-Jeghers hematomas, are they malignant or not? There is one more MCQ. By nature, hematoma is not malignant, but the Peutz-Jeghers is precancerous. But so that is there is a different area where confusion is there that you brought it here. Villous adenoma is there means jump and answer that it is the most pre-malignant. In case of malaria in liver, what do you see? Kupffer cell hyperplasia is a classical feature. So, carcinoid syndrome may indole acetic acid. Glasswares is hot air oven. Don't get a feel that in hot air oven glass will break. That's a common feeling everybody will get on this MCQ, I know. But still, hot air oven is for the glassware. So, male bacterium mates female bacterium. What is that called as? Conjugation. This is what the examiner's simplicity, right? So बीच में आई एम जस्ट चेकिंग एनी चैलेंजिंग क्वेश्चन आएगा बोल के मैं देख रहा हूं. Maybe in the entire history of Maharashtra, this is the easiest paper. I don't know. So, what is drug of choice for MRSA? Vanco. Apart from dental caries, mutants also can cause infective endocarditis. And once more, endocarditis is a high yielding topic. If it is there among the options, that only can be the answer. Right? Then Corynebacterium is Albert-Stein. Leprosy test is not for diagnosis, only for prognosis. Diplopia, dysphagia, dysarthria are all botulinum toxin. H. influenzae typically lead to development of meningitis. Mice is used in the laboratory diagnosis, not for leptospirosis. How many answered this question wrong? Exactly. I am expecting. Why? Because rat urine and lepto is fixed in our mind. Is there a difference between rat and mouse? Are they both same? I don't know. Honestly, I am asking. Is rat same as mouse? Somebody check the Google and let me know. I am from Telugu medium. I only know Elikapilla. So what is rat? What is mouse? So that rat urine leptospira brought us confusion about mice being used in lab diagnosis. Scrub typhus is trombiculoid mite. This is another very standard question. One rickettsial table में से आएगा. अगर our APPG exam will be little more complicated. OX19 positive क्या है? OX7 positive क्या है? All that wheel Felix reaction. You must not be sure. Then isohemagglutinin is typically IgM. Angineurotic edema is C1 inhibitor. This is little tricky question, which is not a subcutaneous mycosis.